Compression test. Head in neutral. Bring the head into, do overpressure. Okay. Extend the head and provide overpressure. Rotate to the uninvolved side and overpressure. Then repeat on the opposite side. And then lateral bend, overpressure. Go to the opposite side, overpressure. Actions. How do we say it? Like
lateral flex and extension.
Lateral flex, extension, rotation. Flexion, lateral flex, rotation. Lateral flex, flexion or extension, rotation. And then flexion, lateral flexion, rotation. Spurling A, lateral bend with overpressure. Spurling B, lateral bend, rotated and extended, overpressure.
I don't have to do it perfect either. I just want to
Lateral flexion, then rotation, then overpressure.
What test is that?
Maximum cervical compression test.
Maximum cervical compression test. And if that doesn't reproduce your symptoms, then you do lateral flexion, rotation, extension, overpressure.
Cervical distraction test. One hand on the occiput, one hand under the chin. Distraction with a slight flexion, neck flexion.
Distract up.
Good. Shoulder depression, lateral flexion to the cervical spine with downward pressure to the shoulder.
Good. If a patient walks into your office like this is known as Bacody's sign.
No, I'll press pause. Neural tension test. Shoulder abduct to 30 degrees, scapular depression, shoulder medial or internal rotation, elbow extension fully, forearm pronated fully, wrist and finger flexion fully, cervical lateral bending contralateral side. Lateral.
Done.
Neural tension test, second variation. Shoulder abduction 90 degrees, scapular depression, shoulder lateral or external rotation, elbow extension fully, forearm supinated fully, wrist and finger extended fully, cervical lateral bending to the opposite side. That's it. Action. Neural tension test, third variation. Shoulder extended fully, shoulder abducted fully, shoulder lateral or external rotated, elbow extension fully, forearm supinated fully, wrist and fingers extended fully, cervical lateral bending to the contralateral side. Brachial plexus tension test. Humerus abducted fully with forearms internally rotated while then abducted. They externally rotated, palms up, and the elbows are flexed, placing the back of the hands behind head. Arm squeeze test. Squeeze.
What do we skip?
Action. Lermit's sign. Skip. We're going on to arm squeeze test. Squeeze the upper arm, middle 1/3. That's it.
That's it?
That's it. Yeah. Sharp pressure test. Slight cervical flexion, stabilizing the axis, the other on the forehead. Press back on the forehead until you feel a sliding motion or thumb.
Rest sign is basically when the patient splints or grabs their head for self-immobilization. Valsalva maneuver. Patient takes a deep breath, holds it, and then bears down as if to resemble defecating. O'Donoghue's maneuver. You basically want to have the patient turn their head against your resistance. Good. Go that way. Any pain here indicates a muscle sprain, and then you want to do passive movement. Any pain there indicates ligamentous sprain. Allen maneuver, you're going to find the radial pulse. You're going to abduct the shoulder 90 degrees, bring it up here. The pulse diminishes and that's a positive test. Adson's test, you're going to check the radial pulse. You're going to extend the arm away. Have the patient look away. If the radial pulse diminishes, it's positive, and then look the other way, and it should come back. Go. Military brace, you're bilaterally palpating both radial pulses. You bring the arms back, either if they diminish or weaken. With the military brace, you want the patient to drop their shoulders down and chin to chest. So right's hyperabduction test. You're going to take the arm and passively abduct it. Feeling for the radial pulse. Wherever it diminishes, go back down, it should come back. Go back down. Wherever it diminishes, you want to mark the degree, and that is supposed to be a unilateral test. So if you find negative. Oh, okay.
I thought you were done.
3, 2, 1. For right's hyperabduction, it should be a unilateral test. So if you find it at the same degree on both sides, then it's a negative and not a positive. Roos test or east test, arms elevated and abducted at 90 degrees, and you're just going to open and close your palms for 3 minutes. The arm should turn colors.